Hi everyone, my name's Erin. I'm a paramedic and I've been asked to do some training on a new piece of equipment we received, which is the nebulizer piece that goes to the BVM. Comes in this package, comes just like this. And the pieces that you need to worry about are the T-piece, the reservoir for the medication, and the oxygen tubing that goes to your reservoir. You will also need a BVM that comes separate to the whole setup. So to get started, you'll need to grab your T-piece, place medication inside of your reservoir, and connect it to the T-piece. Get your oxygen tubing, and this is going to go to your normal flow that you would set up any nebulizer, which is 6 to 8 liters. And then the BVM is actually, instead of going up and down, going to go to the side. And then this will actually connect to a mask. And then your patient is going to be on the other side of this. You may need 2 people to assist you with this. This can also connect to an endotracheal tube, which I can demonstrate to you. It's a very quick setup. Once you get your endotracheal tube set up, connects to your endotracheal tube, and you can bag in a breathing treatment to your patient. The thing that you need to know for sure is that you're going to need 2 oxygen sources, one for your nebulized treatment and one for your BVM. If you only have one oxygen source, you need to hook it up to the nebulized treatment, because if the nebulized treatment doesn't have an oxygen source, you're not getting any medication into the system. This can run off of the ambient 21% oxygen that we have amongst us, but the nebulized piece will not run if there's not oxygen attached to it. 6 to 8 liters for that one. The indications of using a nebulized treatment with a BVM. Basically, you have respiratory failure of any of your patients that you would be giving a breathing treatment to for any reason. You're going to have to pardon my camera person there. Anaphylaxis, they go into respiratory failure and they can no longer ventilate for themselves. You're going to continue ventilating a breathing treatment in. You can use the mask or the endotracheal tube, depending on what you decide is necessary. Your COPDers, your asthmatics, when they go into respiratory failure, that doesn't mean that they don't need continuous breathing treatments. Now you have the way to continue those breathing treatments after they've gone into respiratory failure. This is by no means a recommendation of treatment. This is just a tool in your toolbox that you can use for continuing treatments when people go into respiratory failure. Like I said, you can use it with an endotracheal tube. You can also use it with a combo tube. It's the same connection. Probably less effective in a combo tube because of the location of the supraglottic airway, but definitely worth a try if you were a last-ditch effort. Connects to the mask as well. You might need 2 providers for the mask to help you hold the mask. If you have any other questions or concerns, you can contact myself or Travis, and I think that pretty well covers the setup. Like I said, it comes pretty well put together for you. You just need to connect the reservoir and the oxygen source and the BVM.